So you've fallen to the floor. What do you do next? Hi, I'm Ron the PT guy, and I'm gonna empower you to get up safely from the floor. Hey guys, I'm Ron from Empower Home Health Physical Therapy, and welcome back to our channel. If you're enjoying and finding some value in some of the content that we're putting out, please take a quick second to subscribe and you'll never miss a new release. And of course, we love the likes and love the comments. It's great for the algorithm, but it also helps us grow our community. So we're gonna talk about Steven today. Now, Steven is enjoying his brand new book with his dog, Banner, when his wife decides to call him for a favor. So, of course, Steven, the loyal husband that he is, will do anything for his wife. But the fact that he's carrying a lot of pillows means that he can't really see. And oh, there's a dog toy right there. Oh, he slipped on it. Oh, Steven. I hope you're okay, buddy. Now, Banner, the loyal dog, saw that she left the dog toy there and decided to get rid of the evidence. And here Steven is writhing in pain, wondering what he's going to do next. So, Steven is writhing on the floor in pain. But at some point he realizes that, hey, I may not be as hurt as I think I am. So what we're gonna do here is take a few deep breaths, just kind of take some inventory of the situation. Just think, hey, I'm already on the ground and I'm not going to fall anymore. So now we're going to move on to the body scan. So step one, we're gonna pump our ankles just to make sure that the ankle joints there are unaffected. So you're going to point your toes and then you're going to pull your toes back towards your head. You're going to repeat that several times. So now that that's okay, next we're going to check our knee flexion. So number 2, we're going to slide our heel up towards our buttocks. So we're going to do that on both legs, just back and forth. The good thing about this, it also tests our hip. So it seems like Steve's hips are okay. And now we're going to move on to number 3, hip abduction. Remember, the hip is a multi-directional joint, so it's good to check the flexion here and then bring the knee out to check external rotation. So we're going to do that on both legs. And then repeat as much as you need to confirm that nothing is hurt. So it seems now that we have cleared the legs and we're ready to move on to our ribs. So to clear for a rib fracture, what you want to do for number 4 is take deep breaths. So Steve here is going to put his hands on his torso, take some deep breaths, and just make sure that his ribs are still intact. And usually we do that because there are muscles in between the ribs that expand the rib cage as you take deep breaths. That seems to be okay, so we're going to move on to the arms. First, the wrists. So number 5, we're going to rotate the wrist. We're going to move them back and forth. We're going to wave hello to move it side to side. Wrist also multi-directional joint, so we want to take care of that. Next, number 6 is going to be bend the elbows. Now, like the knees, the elbows only bend one direction, so we're just going to bend them up and then straighten them, just like so. So in Steven's case here, seems that they're okay. Next, for number 7, we're going to check the shoulders. So the shoulder is also a multi-directional joint, so we're going to check flexion first. Good. Going to go back and forth a couple times. And then we're going to do some floor angels to check the abduction as well. So at least we're checking 2 directions there. All right. Seems like the arms are okay, so we're going to check what's most important, his head. So when you fall down, you may feel yourself bleeding, but put your hand back there just in case to confirm that you are in fact bleeding. If not, then you're going to check around your head for any bumps to see if there's any initial swelling. Next, you're going to check your vision. Are you seeing double? Is it blurry? Because we want to check for any signs of concussion. Are your ears ringing? So once you've scanned that, then it's good. You can start to get up. So remember, if you're at this point, just make sure that you still schedule an appointment with your doctor later on in the week just to get everything checked out. Now, if you try the body scan and at any point something really hurts and they don't clear that part of the scan, then you may have a sprain, a strain, or a fracture. So at that point, what you want to do is, if you're in the house with somebody, yell for help. Make some noise, make a commotion so they can come into the room and see what's going on. If there's nobody in the house and you have your phone, then call a friend, call a family member, even a neighbor. And if they can come in and check on you, then that's good. They can help you call 911, which would be the next step. So if there's nobody around, you don't have any family member around, then yes, use your phone, call 911. It is very important for a medical professional at that point to check you out and then determine if you need to go to the emergency room or if you can stay home and make an appointment with your doctor. So you've completed the body scan and you've determined that you don't have any injuries or a concussion. So now it's time to get up from the floor safely. So the first thing you're gonna do is you're gonna roll onto your side, use your arms to push yourself up into a long sitting position like so. And just hang out there, deep breath. Now, if you can't really get to a long sitting position, what I suggest is to roll over and take your time onto your stomach. And once you get onto your stomach, you just want to kind of hang there for a few seconds, just get your bearings, and then get up into the quadruped position, which is all fours, as they say. You're going to crawl over to the nearest piece of furniture. I always tell my patients, if there's a couch there, that's probably the best bet because it has a lot of space. You're gonna get up to the couch, you're going to put yourself upright, put your strong leg on the floor, and then just kind of fling yourself onto the couch. And then, be a little bit relieved that you survived that fall. Next, you're gonna take your time and just use the roof of that couch to roll, to place your hands, to scoot your butt, all that stuff. And then you're in the sitting position and you're ready to go. How do you feel, Steven? Yeah, I feel great about it too. I'm Ron, the home health PT guy. I'm 48 years old, a part-time soccer coach, and a full-time husband and father. And I empower you to get up from the floor safely. But what if there's nothing around to help boost you up? Click on this video right here, and I'll show you how.